I lead the team at Allied Healthcare. We're a UK-based company. We've got 108 branches and we provide domiciliary care services. That's looking after elderly people in their own homes. We help them get up in the morning, get washed and dressed and fed, do the same at night. We have 7,500 care staff across the UK. We also look after people with slightly specialist needs in learning disabilities and continuing care. Well, there are some big differences between healthcare and in the US and in Britain. I think the main difference that you've got here is that you have Medicaid and you have an insurance-based system. In the UK, this is provided as part of the National Health Service or government funding, but it's decentralised, so individual local authorities make these decisions. There's not a national rate, and it's provided to people based on their need. So there's probably a proportion of the population are too wealthy to qualify, but everyone else, wherever their income, would be looked after by the state to quite a high level of care if they need it. We've got 109 branches in the UK, nothing in Northern Ireland, and while that seems a lot, there's 150 local authorities, so we've got quite a bit of space to expand. And if you take somewhere like London, we're very strong in South London, but the whole northern part of the city we have no activity. We've one branch in Birmingham, one in Manchester, so I think between filling out those spaces, we've got a big opportunity. And then if you take the specialisms of learning disability and continuing care, we could easily have more branches. It's a big opportunity. We are significantly cheaper than the local authorities. One of the big advantages that we have is that we have employees on 0 hours contracts. We never pay for an hour that we're not being paid, and that's a slightly different model from the local authorities. But in absolute terms, we are about $29 an hour, where the authorities would be doing it themselves at $41 an hour. And 75% of the market is now outsourced, so there's a bit to go, but the bigger upside is the opportunity to gain share. We only have a 3% market share in a market that's reducing the supplier base, so that's really just a massive opportunity for us. It's a big opportunity in the UK. The population is ageing, the same as it is here in the US. It's ageing by about 7% a year, so the market growth is 7% a year. We're growing faster than that growth, and certainly going forward that will be a huge opportunity for us.
Allied Healthcare Group grew over the last 10 years by buying small bolt-on branches until it's got to its current environment where it's got 109 branches. Our current acquisition strategy is not to continue buying these small businesses any longer, but we are currently looking for mid-tier acquisition. When I talk about mid-tier, we're probably talking about the 20 to 50 million turnover business, which will give us an additional 10 to sort of 20 branches to add into our branch network, and also give us the benefit of achieving some head office synergies by combining two sets of head offices together. In addition, we are looking at sort of potentially specialist service providers, whereby we can take those specialist service lines and roll those out across our branch network. In addition, we've got some geographical infill we would like to see across the country, and that will be achieved by doing a mix of organic branch openings and strategic, branch purchases in some of the cities like Manchester, Birmingham and sort of North London, where we currently do not have much exposure. Allied Healthcare Group has a strong balance sheet. 18 months ago it sold off its Allied Respiratory division for 36 million sterling pounds. This resulted in a group which had over 10 million of cash in its bank at the 30th September 2007, and since then it has grown its cash position to over 19.7 million sterling as at the 31st of March 2009. This shows the cash generation capabilities of this business. It is a people business. It does not have significant investments in capex or working capital requirements, and hence the majority of its profits drop through into cash balances.
We're in a growth sector, we're the market leader in a market where we've only got a 3% market share, where the suppliers are consolidating. We've got opportunities for acquisition, we've got opportunities in specialist areas, we've got no debt, we're with cash. And I think in the last 18 months we've got a much stronger management team, because it's all very well being in a good marketplace, but you need to have a capable and sensible team to execute it. And I think we're making those sorts of improvements every day.